Welcome to the Stop Dieting podcast, hosted by best-selling, award-winning author and renowned weight loss expert, David Medansky. If you struggle to lose weight or you've lost weight and gained it back, you'll want to listen each week. Each week, you will learn tips for healthy weight loss without going on a diet, without having to follow an exercise program, without counting calories, or having to purchase special meals or products. The Stop Dieting podcast is more than just about healthy and sustainable weight loss. You will also learn how you can have more energy, feel better, get rid of brain fog, and improve your overall health. Stay tuned for another informative and insightful episode. And if you like what you hear, be sure to subscribe and share this with your friends.
Hi, welcome to another episode of Stop Dieting. This is your host, David Medansky, and today we have a very special guest, Dr. Kerry Reller. Dr. Reller is board-certified physician in family medicine and obesity medicine practicing in Clearwater, Florida. Welcome, Dr. Reller.
Thank you so much. Thank you for having me today. I'm excited.
So how did you get into being a certified physician in obesity medicine?
So great question. I basically have been interested in health and fitness most of my adult life. And honestly, during the pandemic is when things got a little, slow. And I was looking for other, resources to learn and help my patients more. And I kind of just stumbled across it. And I'm really surprised I hadn't stumbled across it sooner. And I'm kind of bummed I actually didn't even, learn this stuff during residency or anything like that. And we just weren't taught about obesity medicine at all as a field. So I didn't come across it till 2020, but we was, discussing with you a little bit earlier, but I had kind of had a passion for weight and fitness before, because I had my own journey as well. So not till recently, but it's definitely helpful for my patients. So,
Well, tell us a little bit about your own weight loss journey.
Yeah. So I guess as I entered puberty, I started gaining weight a little bit more, and it was affecting my fitness level for trying to be competitive in soccer. And I had parents that, were trying to help me out. So they encouraged me to go into Weight Watchers when I was 18. And that was at the end of my senior year of high school. And, it worked for me. It kind of taught me how to eat right. I obviously didn't do it once I left for college, but I did do it again and signed up with, again, parental encouragement in college after I studied abroad, when I gained a lot of weight just from totally different lifestyle, not working out as much. I walked a lot, but the different eating habits and definitely alcohol consumption for enjoying the studying abroad lifestyle in London. So I've been involved in Weight Watchers pretty much since then, on and off, but I definitely have been a lifetime member since 2003, I think 2002 or 3. And I still go and weigh in monthly now. And I think that it's been an evolving program that they have. And, it's good for some and not good for others. But that was kind of my journey. And since I've started studying obesity medicine, I think it's kind of reached different goals. And I have, probably lost that last 10 pounds I never thought I could do, because just learning different things. And that's more it's a disease that has to be monitored. And I do that by weighing in daily, and kind of keeping accountable to myself as well. So
you indicated that obesity is a disease. Could you elaborate a little bit on that for the audience?
Yes, I had a feeling you would ask me that. So I actually wrote out what the Obesity Medicine Association defines obesity as a disease. Okay. So obesity is defined as a chronic, progressive, relapsing, multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces, resulting in adverse metabolic, biomechanical, and psychosocial health consequences. There's no way I can memorize it. That's why I wrote it down. But that's kind of encompasses the whole body changes that happen with the disease of obesity. And that's why we considered that, because a disease is actually, defined as a condition of the living animal or plant and one of its parts that impairs normal functioning. And that usually manifests in signs and symptoms. So because of the definition of actual disease, we usually think that obesity should be defined as such.
I find that interesting, especially since approximately 72% of the US adult population is overweight, of which 42% are considered clinically obese. So we're talking approximately half of the US adult population as having a disease, and yet it seems like nothing is being done about it. As a medical professional who specializes in obesity, what do you usually talk to your patients about?
So, well, first I kind of bring them in and rule out like any other cause that may be, contributing to it. So like for instance, like hypothyroidism, usually I don't see too many genetic causes, like actual like leptin deficiency or anything like that, but trying to rule out things like that, and also check on the associated comorbidities like cholesterol or blood pressure, diabetes, and things like that. And then after kind of teasing out that and what medications they may be on for another reason that could be the contributor to, inducing obesity or metabolic syndrome in those patients, then I kind of move on and, look at their whole lifestyle and, see where things are maybe not conducive to their eating patterns and everything that we can kind of fix a little bit. So we start out, taking a really good history. And then my step one is usually kind of trying to discuss with them to eliminate sugar sweetened beverages. And it's really hard for people to make progress there. And actually I had a patient recently who was drinking 96 ounces of Mountain Dew a day.
Wow.
And it's, it was, yeah, he did not really think he could stop drinking soda because he was, kind of getting it free at work. And so I don't usually condone like switching over to diet, but I'm like, you could at least consider that. So he did do that. And he's lost like 40 pounds since I met him just by switching off of regular soda. So I usually start there. And then the second thing I start with is listening to your body, right? A lot of people, we are eating for reasons, for pleasure, for joy, for sad, for pain, for whatever reason, like an emotional reason, right? Not to fuel our body, and often overeating. So I usually say, listen to your body. Are you actually physically hungry, or is this emotional hunger? And I often give them the tool of a hunger scale to kind of, I guess, diagnose what they think is going on and learn that, they need to eat in this certain range and not, where they feel like they need to lean back and, open their pants because they're too full or whatever. Right. So I tried to give them the guidelines of a hunger scale. And I usually do a -10 to +10. And tell them to eat in like a -4 to +4 window. Like 10 is, going to be next week, Thanksgiving, +10 is, and don't do that. Although this podcast will be released in March, I forgot. So anyway, +10 is like, overeating Thanksgiving. And then -10 is like ravenous. You're going to like eat your own arm or something like that. So I try to keep them in that window. And that's really a hard thing for people to do, including myself. Like daily. I think I'm a person that eats too fast. And I try to counsel my patients on not eating so fast, because if you're eating too fast, you're not going to know that you get to that +4, when you do. It's going to come later. Instead, you may have to stop at +3 and then, you stop a little bit earlier so you don't get too full too fast. So those are the first kind of two things I do, I think, most of all. So
well, that's interesting. I know that most of us eat too fast because we're always in a hurry, and we're eating it while working or watching TV or being distracted. So I call it mindless eating. I read a book by Mark David, who wrote The Slow Down Diet. And what he advocates is if you take 5 minutes for breakfast, give yourself 10. and at a minimum, give yourself 30 minutes for lunch and 30 minutes for dinner. And just take time away from whatever you're doing and focus on the food you're eating, as opposed to, eating while you're driving or at work. I'm curious.
Exactly.
I am against diet sodas because of the
Mhm.
aspartame, which causes weight gain. So I was curious as to why the person with the Mountain Dew would switch or reduce the amount, maybe switch over to water in between two. I mean, I was just curious about that.
Why wouldn't he? So he works at a gas station and he gets those big giant foam cups of
Ah,
soda. And he just like said that's not something that he could really do.
okay.
So I was just trying to, do what I can in one way to not progress him to progress to diabetes. So um that's all he said he could do. Sometimes you have to work with the patient, right? I agree. I don't really want to encourage diet soda use, but I do think it's somewhat better than regular soda.
I
So
appreciate that. I
usually
just
I
wanted,
definitely
yeah.
water, but yeah.
Yeah, I just wanted to clarify so that some of the audience won't think, oh, diet soda is okay.
No, definitely not. No, I'm not really. Yeah, that's why I said I don't really condone the diet soda, but I got to meet everybody where they're willing to budge on their habits.
Now, there's differences with obesity physicians. Some of them recommend the bariatric or the lap bands for treatment.
Mhm.
Some recommend lifestyle changes. Some recommend, changing eating habits. Um, what's your opinion about some of that?
So I think you got to see what the patient is interested in. I think lap bands are definitely out of favor if you're talking about bariatric procedures. I think that can be a good choice for a certain person. I definitely like to start with lifestyle modification. I do think if they have diabetes or insulin resistance, there is a role for medication and to help make the cells more sensitive to insulin. And there was one other thing you asked me that I can't remember. You said you, it was the bariatric or
Lifestyle and eating habits.
just lifestyle. Yeah, no, that's definitely where we start for sure. Yeah, lifestyle and eating habits, and bringing in the whole picture of everything too, not just eating habits, but mindfulness and water intake and movement and everything. Yeah.
It sounds like you take a lot of time with your patients as opposed to just spending a few minutes in and out of the office like most physicians have to do now because of various reasons,
Mm-hmm.
which I don't want to get into, but it sounds like you do take a lot of time with your patients.
I do. I try to. And I mean, I wish I could give even more time, but that's not that realistic because I am in a fee for service model. But I give at least 30 minutes for a new patient weight management visit. Yeah. And for the follow ups too. And sometimes it takes more than one visit to do the intake.
Have you heard of that new drug that people are using to curb
Mm-hmm.
appetite? I believe it's Wavy.
Wegovy?
Wegovy, yeah.
So there are several. Those are the GLP ones. Wegovy is the one that is FDA approved for obesity. Its counterpart is Ozempic, that's for diabetes. And there's an even newer one, Mounjaro, which has the GLP-1 and GIP intestinal hormones that they are agonists for. That it work very well, and they're very good in diabetes. So basically, with uncontrolled diabetes, we measure, the hemoglobin A1C or the blood sugar, and it's an average of that blood sugar over the 3-month period. So when I was trained in residency, they told us to start insulin like when that hemoglobin A1C is above 10. Now, the diagnosis of diabetes is at 6.5, and the diagnosis of pre-diabetes is at 5.7. So 10 is considered really uncontrolled diabetes. They told us to start insulin. Now, if I did that now, the people would never come off insulin. Insulin is a fat storage hormone. They're not going to, be able to release any fat, and they would still be struggling with elevated blood sugars without doing that. Instead, with these new drugs that are, the GLP-1 agonists, were able to not have to do insulin. And actually, these are so good for weight loss because the GLP-1 hormone also works in the brain, in the hypothalamus, to decrease basically to cause satiety or, feel that feeling of fullness. So those drugs actually help people feel fuller, faster and longer. That's how they get weight loss. Yeah.
Once the person loses the weight, are they able to keep it off? That's the question, because as you and I know, 90% of people who lose weight on a diet gain it all back after they go off the diet, because they revert back to their old eating habits. So is it part of the process to re-educate them as to their new eating habits?
Yeah, definitely. At least, what I'm doing is definitely trying to bring in the lifestyle component as well, because you're totally right. If they, the big thing is if they come off the medication, they're still likely to gain the weight back. And I don't think we have enough long-term data to know like when is an appropriate time to remove the medication, if ever. So these medicines, like I said, obesity is a disease. They're meant to be used, to treat the disease long-term. Yeah.
Yeah,
So,
I agree with you on the disease part, only because I consider a lot of the manufactured and processed foods to be addicting, especially the ones loaded with sugar and salt and fat that are scientifically engineered to optimize our cravings for them. So there's certain foods such as Pringles potato chips, M&Ms, Hershey bars, I need to avoid like an alcoholic avoids alcohol. I'm not an alcoholic, but I know that if I have just one or two of those, I won't stop because of the addiction part of it.
Absolutely. And I see a lot of that too. And honestly, I don't give anyone a diet or anything. Sometimes I give them, a handout on what are some healthy foods, maybe at a pattern of eating, because they may not have any nutritional knowledge yet. And I can say you can take a, a moderate approach, an aggressive approach, or, and then, we decide later on if it's working out, right? So I may say my most aggressive approach is eliminating sugar and flour exactly for the same reasons that you just mentioned, and obviously less processed foods in general. And if they don't think they can do that, I might do a step down of, quote, everything in moderation, right? And maybe reducing portion sizes and things like that. But if they have that addictive personality like you, they may, have trouble doing everything in moderation, and they really need to consider the next level of like getting that out of their diet and seeing how their, mind changes as well.
Yeah, a mindset's very important with the behavioral changes.
Yes, totally agree.
What do you believe, or is your opinion as to why people overeat?
Why they overeat? I think they overeat because food tastes good. They like the sensation of feeling full. They kind of can't stop themselves when they're eating. That's like if you're eating and you want to not stop eating, right? If you're then for overeating in general, of when you're not actually hungry and you're just eating, you're eating because it's time to eat. You're eating because the person next to you is eating, right? You're eating because you won the game, you lost the game. Same thing with alcohol, right? You're celebrating for a good reason or a bad reason. And food and alcohol do go hand in hand with that. So I think they're overeating it because they can't stop. I mean, until, soon enough. They should be stopping earlier, but then also they're eating because they're not physically hungry. And I think that's a big part of it. And people, sometimes I ask them all these questions of, do you emotionally eat? And I try to define it for them, and they still kind of say no. And I'm like, I bet you do. Everybody does. I do 100%.
Yeah, I do too. I used to believe that people overeat because of comfort and stress. However, I've changed my opinion since then. And I heard another medical professional state it's because of convenience, because it's easier to go through the fast food drive-through window. It's easier to order a pizza or pick up a bucket of fried chicken, or pick up some Chinese food, or get the frozen meals and pop them in the microwave. So we've become lazier as we've increased our knowledge. It used to be you would see people at the grocery store with their motorized carts, shopping carts, driving around, and instead of walking. And now they don't even have to go to the grocery store. They can just, have it delivered to their home. So it's making it more convenient for them to get food and less physical activity.
Yeah, that's totally true. So that's part of our like primitive brain that works like with convenience and pleasure and just wanting to get access to things easier, right? So that's one way to combat that, like without, like when you're on the way home from work and wanting to go through the drive-through or whatever, is to have patients kind of make a plan for what they're going to eat the day before, and using your executive cognitive prefrontal cortex to make those decisions, right? Like even for yesterday, for example, I had a plan that I was going to eat healthy, right? Or stick to what I normally eat, so like maybe eggs for breakfast or something like that, right? And then I go to a lunch and they have pharmaceutical reps brought us a lunch, right? They brought us those Chick-fil-A cookies
Oh,
that are
geez.
like one of my favorite things. And when I was pregnant, I can't tell you how many I ate. Okay. But, I didn't plan for it that day. So what you can do is, okay, maybe I'll take one home, I'll wrap it up. And when I plan for it, I will eat it then, like when I am prepared to make that decision, right, with my executive brain rather than my toddler brain. So I often, try to get people to make a plan of food to be able to combat that. Oh God, I'm too tired, I'm going to just go through the drive-through, or, somebody brought in an awesome meal at work and I'm just going to eat that instead of my healthy salad I brought or something like that. So making a plan
Yeah,
helps.
I understand that. I usually have three little lines I use. The first one is more for you, so I don't have to eat it. The second one is it'll look better on you than me. And the third one is better in the trash than on my ass. So,
Oh, that's a good one too.
and
Yeah,
as
we
you
are not
mentioned,
garbage cans. Yeah.
yeah, or when the holidays coming up, when people go to their hostess usually made um, meals and gone out of their way, to prepare the meal and the expense. So people sometimes feel obligated. So usually I just tell people, look, just explain to the host that you're on a restricted diet. They don't need to know why you're on a restricted diet and that you appreciate the effort, but you're unable to enjoy certain things that they've prepared for them.
Yeah. Or you can also kind of wrap it up and take it home and decide whatever you want to do with it at that point as well. Yeah.
Exactly.
Mm-hmm.
Are you able to work with patients outside of Florida, or does it have to be more in person?
Well, technically, I know I can be not in person, but it does have to be in Florida right now. I'm only licensed in Florida right now.
Okay.
Yeah. I think in the future, one day I will be, doing some more telemedicine, but I'm not able to it yet. Yeah.
What else? What other advice can you give to the audience about changing their lifestyle and eating habits?
I think, well, like you were saying with the convenience thing. So I think it's important to kind of make purposeful movement, right? We only have like an attention span of about 50 minutes, they say, or you can work well for 50 minutes and then you should take a break, right? So for that break time, you should get up and walk around and drink your water. And I think that's, usually a good cue, especially if they have one of those, Fitbits or watches that kind of remind you to move. So I think that's good, just kind of getting in purposeful movement. And then I think water obviously is important too. It's often a reason why you think you're hungry and you're not. So I usually say just make sure your urine is clear, drink half your body weight in water in ounces. And let's see, what are...
Oh, that's great advice.
Mhm.
Because I know that 75% of the US population is chronically dehydrated. And in my opinion, there's a direct correlation to 72% of the US adult population being overweight. As you mentioned, a lot of times when people are thirsty, they think they're hungry. So they eat instead of drink water. And what I tell people is our bodies are 60 to 70% water, not soda or diet soda or fruit juices or fruit flavored beverages or alcoholic beverages.
Mm-hmm.
Now, I'm not a purist by any stretch of the imagination myself. I mean, I do enjoy a glass of wine or a piece of chocolate cake or pumpkin pie or pecan pie every once in a while. The difference being instead of eating a full slice, I'll just have half a slice or a sliver of it. So let me ask you a question. To reduce portion sizes, what do you recommend for patients?
Well, I think if you can learn to eyeball it, but I think if they're just starting out, it might be helpful to actually measure things out. But still, while I'm suggesting a certain portion size, it still goes back to, are you even still hungry, right? So going back to the hunger scale, right? Just because I said you should eat like 3 to 4 ounces of grilled chicken doesn't mean that you have to finish every bite, right? I want you to actually listen to the body and stop sooner. So learning like what may be a normal portion for things is important. The plate method is very helpful, right? So usually you don't want to use the large dinner plate, perhaps the smaller plate, like the salad plate, and you want to fill half the plate in vegetables, and then a quarter of that would be lean protein, and then the other quarter can be split with like carbs and a healthy fat or something like that. Is kind of what I usually try to have people learn.
Oh, I'm glad you mentioned that, because a lot of people don't realize that our portions have been supersized without knowing it. In the 1900s, the average dinner size plate was 9 inches in diameter, and today they're 12 inches. And at restaurants, they're 13 to 15 inches. Yet in Europe, it's still 9 inches. And in Europe, they slow down and eat slow, where we tend to eat on a dinner plate instead of a salad plate, like you suggested, which is a great idea, and then eat slower. Plus, there's that Balboa illusion where if you put the exact same amount of food on a salad plate as a dinner size plate, on the salad plate, it'll look like you're getting a lot more food. And on a dinner plate, it'll look like you're getting a lot less, even though it's the exact same amount. So that optical illusion can cause people to overeat sometimes. So I'm very appreciative and grateful that you mentioned that for the audience.
Yeah, I didn't know that about the European size plates, but it doesn't surprise me. Another way to slow down eating, you can eat with opposite hand. So I've tried eating left-handed, and that helps me a little bit too.
Yeah, I used to be a very fast eater, so I made it a game as to how slow I can eat. And then I learned to put my fork or spoon down between bites instead of using it as a shovel to eat as fast as possible.
That's a good tip too. Yeah.
Yeah. When I lost my weight, I was on HCG, but I don't believe it's available any longer.
Like the injections?
Correct.
I did have one patient come and tell me they were on that diet. I do not know if they were getting injections or not, though.
Okay, because I know that my physician, internal medicine, said it was no longer available, something with the FDA not approving it anymore. And on that, it was 550 calories a day for 6 weeks. The difference being the injection tricked the body into burning fat instead of muscle. And if you weren't on the injection, then your body starts burning the muscle, which is detrimental to your health as opposed to, losing the fat. I had a friend that wanted to prove me wrong, so he just basically went on a starvation diet, lost the weight, however, lost all his muscle mass and had some issues with that. So he says, well, I'm going to go to the trainer and work out. And after 2 weeks, he asked me, can you lift more than 15 pounds? I said, yeah, why? And he says, well, I'm not able to. I said, what does your trainer say? He says, I'm not eating enough. I said, okay. What do I know? So I know a lot of people, when they think about losing weight, they want to go on a starvation, and that's the wrong way to do it, because then your body fights to, keep the weight on.
That's right. Yeah, definitely. And I think you mentioned like the muscle mass loss, right? So that's something that I do with our patients. I don't have like a in-body scale or anything like that. Those are quite expensive, but we do give at least a scale that has a bioelectrical impedance. So it does measure the fat mass versus the water mass and lean mass. And I think that helps too, because there are definitely people who've come in who maybe, stayed the same or even lost a lot of weight, but their lean mass went up too. So they lost even more fat, or their lean mass kind of went down. And I'm like, hey, we need to watch that. We need to increase your protein, because we definitely don't want muscle loss here, only fat loss.
Yeah. What was interesting, I had 6 other friends who went on the HCG diet like I did. Every one of them regained their weight back. I'm the exception because I changed my eating habits and lifestyle, and then they reverted back to their old eating habits. So that's what I tell people, is you got to change your eating habits and lifestyle. The other thing is, when people with their New Year's resolution start going to the gym and exercising more and eating healthier, after a couple of weeks, to get frustrated because the scale's not moving. And what they don't realize is they're converting their fat into muscle, or they're converting
Mm-hmm.
muscle and replacing the fat. And as you and I both know, 5 pounds of muscle weighs the exact same amount as 5 pounds of fat. The difference being that the muscle is denser and takes up less room. So
Mm-hmm.
usually I'll ask people, because they're getting frustrated, they're on the scale, it's not moving. And I'll ask, well, how are your clothes feeling? And they're like, well, it's loose and I have more energy. And it's like, oh, okay. And sometimes one of my clients even said that people were asking if he was losing weight when he wasn't. And so I said, don't go by the scale, go by how your clothes are
Right.
feeling, because that makes a difference, especially when people start, doing more physical activity and exercising more.
Yeah, absolutely. The alternate view of that is that they're going to the gym as their New Year's resolution and they're not fixing the diet, like what they're eating, right? So there's another reason why maybe their scale isn't moving. But like you said, it could just be muscle and they were, maybe dropping some clothes sizes instead.
Yeah, in this case, he was walking an extra 5 miles a day and riding his bicycle.
Mhm.
So I knew there had to be a reason, because he said he was following everything that I was suggesting for him.
Mhm.
And I said, something doesn't add up here.
Yeah, yeah. I'm sure but exercise is really mostly important for bone health, right? Mental health and cardiovascular health, but not as much for, weight loss, but it's very good for weight maintenance, right? So you mentioned like if you change your eating habits, right? And the other people didn't, they regained their weight. So when they're starting to go back and eat the same amount of calories at the lower weight, their body isn't going to metabolize that, so that they are going to obviously, put the weight back on if they aren't doing anything, like physically active or to cut the amount of food that they're eating. Yeah. You
Oh,
can't just go back
yeah,
to the old ways.
absolutely agree with you 100% on that. It's just that's unfortunate that people, 90% of people who lose weight on a diet regain it within a year. Some gain even more.
Mm-hmm.
What I was reading was that the average person will attempt 4 to 5 new diets each year, and
Oh,
the average person will attempt 126 diets during their lifetime. So
wow.
usually I tell people, if you want to lose weight and keep it off, never go on a diet. Instead, change your diet.
Right, right. Yeah, I often, every visit, I check in with my patients and make sure that I'm like, this is sustainable, right? This is not hard. Like, these are changes that you can do forever, right? We're not going to just do this for a couple of months and that's it, right? So they usually say yes. So that's good, because I'm not, let's not just start keto or something like that. That's not what we do. Yeah.
Yeah. What's your opinion on the keto diet?
I think it's very effective. It works very well, but I think it's not sustainable.
So
Yeah.
short term.
Mm-hmm. Yeah, it definitely works well, but nobody ever stays on it. Very rarely. Mm-hmm.
Yeah. The one diet that I recommend is really not a diet. It's a lifestyle, and that's the Mediterranean diet.
Mm-hmm.
It's just,
That's usually my handout for all the patients when they aren't sure what to do. It's like a Mediterranean pattern of eating. And that's where I, tell them the protein carbs, and the protein or the fat and carbs of, if they don't have any idea of where to start with changing things or making a meal. I'm not going to hand them like a meal plan. That's kind of just some tips on what's a good choice there. Yeah. And it's the Mediterranean that I choose to.
awesome. Um,
Mm-hmm.
any books you can recommend to people for improving their eating habits and weight loss? Anything that's resonated with you or that has made an impression on you?
I think most, personal help books can apply to weight loss if you want them to, right? So one of my favorite ones I read recently was Eat That Frog, and that's about like Stop Procrastinating by Brian Tracy. And this was really cool because I was in North Carolina and I saw a gym called Eat That Frog Fitness. I'm like, oh my God, is this based on the book? And sure enough, it was. So the idea behind the book is that you want to like kind of do your most significant, like changeable task that's going to make the biggest difference, except you really don't want to do it, but you want to do it first thing in the day. And some people that's exercise. And I think that's how that gym kind of, or that fitness center, modeled their, I guess, program or whatever, is basically get it done, do it first, and you'll feel much better throughout the day. So that's Eat That Frog by Brian Tracy. And there's another book I'm reading, Positive Intelligence by Shirzad. I don't know his last name, but that's more on the mindset piece of things. So he's got, I guess he suffered for depression throughout his childhood and was able to come out of it. And his book talks about these 10 saboteurs that exist in your brain. And then there's the sage that has 5 powers. And the saboteurs are like something like an avoider, like me. I'm like a procrastinator, right? And then there's like a people pleaser, and there's some other ones, but everybody has a judge, right? And so the judge is like, you're judging yourself, you're judging others, and maybe putting yourself down or something. And his book kind of teaches you how to overcome the judge, overcome the saboteurs, and strengthen your sage. And it's kind of using what he calls his PQ. I forget what the Q is, but and it's kind of like mindfulness and meditation. It's just mindfulness and meditation are a subtype of PQ reps. So you have these things that you do that may strengthen your sage and kind of, I guess, get your mind more aware. So one for food, I guess, related things, maybe eating slower, really tasting the food. Like you said, mindful eating, right? Yeah. Feeling the texture, the smell, the taste, the touch, and everything like that, and appreciating that. And then same thing with other simple habits that you do throughout the day, like brushing your teeth, right? You can just taste the toothpaste, feel the toothbrush on your teeth, and things like that. And it helps strengthen the sage and decrease all those saboteurs, and kind of give you a better overall mindset, and decrease in anxiety and stress, and decrease those cortisol levels that are usually elevated in anybody that has stress in their life, which contributes to obesity, as you know. Yeah.
That's one tip I like to give to people, that a lot of people aren't aware of, that if you brush your teeth after a meal, it reduces your cravings and suppresses your hunger.
Yep. I usually, if you brush your teeth right after dinner, you're less likely to do that late night snacking that kind of really sabotages everybody's good day that they may have had, right?
Yeah, I can relate to that.
Me too.
And the other thing is, like you were talking earlier, about 90 to 95% of our weight issues are based on what we put into our mouth, and not so much the physical activity. I know that some people have, medical issues that cause weight issues, and also hormones are an issue. Do you test for hormones with a lot of people, a lot of your patients?
So no, well, thyroid, yes. And sometimes I would say we might do a fasting insulin, but that's to catch like diabetes or prediabetes before, you might even be diagnosed with prediabetes. So usually insulin resistance is present way sooner, and we can, get that. We also, do cholesterol, which usually if you have something called metabolic syndrome, it's often similar to insulin resistance. So we're kind of trying to pick up on those things. I usually only do hormones if people are twisting my arm, because I don't think, actually, I'm sorry, testosterone deficiency is real. It can cause elevated cholesterol, and it can be, a big reason why people are gaining or not gaining weight and feeling fatigued. However, if they have overweight or obesity as well, typically they're not going to get better without lifestyle improvement. Like that might be the cause of why they have the testosterone deficiency.
Yeah.
So you gotta weigh your pluses and minuses there of whether you should replenish them with testosterone injections or not. So that one maybe, but menopausal hormones I don't typically do. If you're not having a period, we don't need to, know that you're in menopause. You probably are. And typically the metabolism does, kind of slow. I keep reading conflicting evidence. It's either 60 years old or, a little sooner. So long answer, I don't test that many hormones. I try to practice evidence-based medicine. So.
Okay. That's interesting. That's good to know. We all procrastinate when it comes to improving our eating habits and losing weight. I know I did. I used to, wait till Monday after the holidays, after vacation, after we go to a restaurant with our friends. When you tell somebody they're either a pre-diabetic or a type 2 diabetic, does that usually turn the light bulb on? Do they usually get more motivated, or is it, well, okay, what medicine can I take to, resolve this? How do most of the patients react with you on that? I'm just curious.
Yeah, it depends on the patient. For pre-diabetes, maybe not as effective. Diabetes, I've had 3 patients who I've told they had, pretty uncontrolled diabetes, like above 10 on their A1C, and they have come back to me 3 months later, totally different with controlled A1Cs. And yes, I might have helped them with a little medicine, but they really made huge changes and then even lost a lot of weight as well. And it's quite impressive. So I could think of 3 people recently that just totally changed everything. And then I can think of a person also who hasn't come back. So I don't know what's happened to her, and it makes me kind of sad, right? I don't know. That's the one thing I would say to people is just keep trying, keep coming back. That's what we're here for. We're not trying to, make her feel bad or, belittle anyone. I think it's just, we're here to help. And that's why I do what I do.
Yeah, I was fortunate. My doctor was just real blunt with me. Back in 2016, he told me, based on my lab results and being fat, I had a 95% chance for a fatal heart attack. So, he'd been after me for 8 years to lose the weight. And he gave me 2 options: lose the weight or find a new doctor. And he strongly encouraged me to find a new doctor because, as I said, he had been after me for 8 years to do something and I hadn't. This time I did, and I've kept it off. So.
Good, yeah. I mean, that's interesting that you took it and turned it around and made it a good thing, right? A lot of people, when they go to other doctors, they don't get that same response, right? Maybe they are, they have overweight or obesity and they go to an orthopedic and they're having joint pain, right? They just say, go lose some weight and come back and then I'll do the procedure. Like that doesn't resonate well with, most people. And that isn't necessarily going to be a motivator to drive them to go lose the weight. It might just cause emotional eating and make it all worse. So it's hard to know. Yeah.
I understand that. I met, when I lost the weight, my wife and I were on vacation in Costa Rica, and I met a internal medicine doctor, and we were talking, and he was overweight, and he said he had to lose 80 pounds to have a hip replacement because his, friend who's an orthopedic surgeon wasn't able to get in there to replace, the hip because there's just too much fat. And we were talking a little bit about everything. And then he said to me, well, when you get to my age, you look at things a little differently. And I said, I understand. And he says, what do you mean you understand? I said, we're about the same age. He goes, no, we're not. I said, well, how old are you? He says, I'm 59. And he looked at me, he says, how old are you? And at the time I was 63. So I told him 63, he just shook his head and walked away. I never saw him again. So
God,
what I tell people is it's not the age, it's your mental attitude toward it. In fact, this past June at 67, I hiked up Kilimanjaro. So if nice. I can do it, I tell my audience, anybody else can do it. Just, put your mindset to it and change your eating habits and lifestyle.
Totally. I agree. That's awesome.
What's a good way for someone to get in touch with you if they're in the Clearwater area or in Florida or just want to reach out to you?
Sure. I guess Instagram on Clearwater Family Medicine. And it has that Linktree link as well on that site. And then under Facebook at Kerry Reller. And our office website is, I guess, just kerryrellermd.com works probably the easiest. Yeah.
Well, this has been super exciting for me to be able to talk to you. I appreciate you taking the time and spend with us. And can you leave one final thought for the audience?
Yeah, like I said before, I said, don't quit. Please keep coming back and keep trying, and things will get better and work itself out. So just never stop trying. Don't quit.
Sounds great. Thanks so much, Dr. Keller, for being a guest today. I really appreciate it.
Yeah, thank you so much for having me. It's been great. I appreciate it.
Thanks for listening to the Stop Dieting podcast. Remember to like and subscribe so you won't miss a single episode to get more healthy eating and lifestyle tips. Motivate and inspire others to be healthy by sharing with your friends.